name is Caroline Bensam Finley. I'm a licensed clinical social worker, and I've been in the field for just about 30 years now. And my primary work has been as a child and family therapist throughout the years with all ages. And then also in more recent years, I spent a good number of years working in infant and early childhood mental health consultation. And that's been really a very wonderful part of my career, I think. And I helped to run a program in Connecticut and a full statewide expansion in the state of Maine.
And that's so amazing. I think what's always very interesting about getting into this space is kind of how you chose to focus. Obviously, and typically, traditionally, you think of therapy, always the classic example in people's minds is maybe that you're sitting on that long couch chatting. But obviously, youth, family, child therapy is extremely important. How'd you end up focusing on that specialty specifically? Was it just through your experiences you felt you had you enjoyed it more, there was better fit? Because it's always interesting to figure out how people kind of choose their path in life when looking back.
But I think that for me, initially, before I even got into the field, I always thought, well, I'll never work with kids. I don't know why. And in fact, I actually loved working with kids. And I don't know why that would have even been in my brain. But then I really just kind of fell into working in child guidance clinics, working in partial hospital programs with children. Then I did private practice where my sole focus was child and family therapy. And I found, that just working with kids, is really nice just because you have a chance to help them talk through whatever is going on, paying attention to what their needs are. And oftentimes things are just misunderstood in children. And then to get into this path was our state is really unique in that it started one of the first early childhood mental health consultation programs in the nation. And it's an evidence-based best practice model. And so because we had it in our state and I was connected to some people involved in it, I was able to move into that role. And then just really that took off from there. It's nationally recognized in that. So I really had a lot of good exposure to a lot of different theories and thought processes.
And that's so interesting. I know it's even on a state by state level. I know I was talking to some other clinicians. One of the universities they were at had a youth focused course path. So they had experience to this. But I talked to another clinician. I think they said the only time they ever heard about youth mental health was like a part of a one lesson. It was like not even a part of the curriculum or even exposure at all. So it's very interesting how obviously the states are getting more involved, to at least allow the exposure to it. Because for many, who've been into this field, they love it and they had no idea whether it be through their early education that this was even to some extent a possibility. They kind of have to fall into it. One thing you touched on, it's always interesting is, when we talk about therapy and youth specifically, we talk to, communicating with them, obviously children communicate differently. It's not the same lexicon. They don't have the same verbal, and there's a lot of times play aspects to it. And I find oftentimes talking to parents, especially when working with people who work with younger kids, it's the parents like, well, what are they doing? They're playing. What is this? How, I guess a two-part question is, obviously youth focus more on that play or kind of that aspect. So how do you communicate with children who maybe don't have that, they're younger, they don't have the same, be able to verbalize. And then also on the other side, I'm assuming a lot of times parents are asking questions like, how is that therapy? You're just playing with the child. And obviously play has a lot of communication. So kind of answering both those questions, how do you explain really what's going on when from the outside looking in, it doesn't maybe elicit what people view as therapy because communication is so much different?
Yeah, I mean, I think that one of the things, especially the younger you go, the very young child just doesn't have the verbal skills yet to express what's going on. And so with the very young child, they are acting, they're playing, they're moving their, the toys or the figures, whatever, in different patterns and different, acting different ways and making them do different ways. So it's an extension of potentially how they're feeling or making sense of their world. right? And we may not know officially what they're saying in that process, but you're using it to help kind of get a sense of where they're what are they leaning towards. If there's a lot of aggression in there, what's happening behind that. If there's a lot of hugging and or joyful stuff, that's a good sign. And so really having that ability to kind of at least interpret, and then try to make meaning with them by being curious as to what they're doing. Again, depending on the age levels, as adults are speaking to children and connecting with them, they're going to pick up those social cues and or actual responses like yes or no. I have a 3-year-old great niece, and she's actually pretty verbal at this point, but periodically she'll say something and I'll ask her a question. I'll say no, and then she'll try to say it again. I go, oh, that's what you mean. No. And so sometimes it takes a little back and forth, which is part of the process of engaging with them, and playing with them, and then giving them those opportunities
I
to
think
play
I think that's
and
with
be a part of the
everything where it's
process.
that give and take, building the rapport, especially when it comes to youth. I mean, it's anyone in life, you have to build the rapport because you're trying to have a conversation. And I think even when you go to adults, there's still that same aspects of being engaged is the most important thing. How do you engage with them? Kind of build that quick rapport and get on their level.
Mhm.
Meet your patient where they are, and with youth, it's no different.
And in this case, sometimes it's physically getting on the floor with
It
them.
exactly.
So
And obviously,
really,
as you know, I
to
have an
your point,
18-month
exactly.
old, and it's the same thing with communicating. Even communicating with her compared to standing versus getting on her level, the interactions are so much different. Just being able to kind of connect literally on their level. One thing that's also, I say, more unique when you get to the younger ages is that parents play a bigger part of it, just because of consent, but also just because the guardians have to be involved in a lot of things are obviously done in home, and kind of continue. The session is maybe once or twice a month, but the rest of the time, parents are probably very interested in how can I help out? How can I be a bigger part of their journey? How do you, I guess, when communicating with parents, as a new parent, it's probably very similar. Everything is the first time experience for me. So some things I think are a massive concern where that's just normal. Hey, they might act out. It's not challenge. But sometimes, obviously, there are things that are a little more serious. How do you have that communication with parents? Where like, hey, this is something to maybe not be concerned with, but kind of be addressed versus, hey, this is a normal behavior. Because I feel most parents, maybe speaking more for myself, you're always everything is 0 or 100, but there is sometimes where it's like, hey, there maybe is more of that middle ground. How do you communicate where I mean, what is normal, but what's more normal, way what's more concerning,
Yeah.
without maybe causing an overreaction from a parent who think very invested in their child.
Yeah, I mean, I think that one thing for children, really predominantly in the early years, but really throughout the whole spectrum of childhood, kids develop at different rates anyway, right? And so parents, read things, they hear things, so they see their neighbors' kids, they see everybody else, and they're always comparing. And so, or, kind of sometimes they're on the end that say, so my kid's more advanced. Sometimes they're saying, wait, what do you mean? My kid's not doing that. And so there's a lot of worry out there that is actually kind of, I mean, this is one of the things I've actually loved about my role throughout the years is that there's actually at times just a reassurance that things are pretty okay, that you don't have to worry about that. Well, what also is good about the role is when there's not a very, like the parent has come in with that concern already, but yet you're seeing something, there's a way to kind of say, let's, is this something that typically happens? Because it could be a one-off. There could be scenarios there where the child, my son at one point, one of my sons, we were at a friend's house and he was acting very, out of sorts, and to the point where he was playing with a glass ornament on a Christmas tree, and I was really afraid it was going to break, and my friend was getting a little tense. Turns out he had strep throat. Who knew? Right. And so there's behaviors that sometimes come up when something's going on that's not indicative of a bigger issue. However, sometimes when parents are coming in, they probably have an inkling that something's going on. right? And so basically, sometimes it's just validating to have somebody else see that there could be something. But I'm also not an alarmist. So, but you kind of look at and direct people to some certain sites. There's an ages and stages questionnaire, right? And there's different things. There's different resources out there that I kind of say, why don't you kind of go through this and kind of see where you fit. And the beauty of the ages and stages is that they can then be linked, if they want to additional tests and resources as they go down the line. But usually if they're coming in, they might have a sense that something could be going on, but also just being validated and
Mhm.
listened to.
Mhm.
Excuse
And
me,
I
is
hear a
a
lot of this also, even like
productive thing, I
same
think.
even on the general practitioner front with going in for your checkup, and it's the same thing saying, hey, you're coming in today probably for a reason. What were those reasons? Just allowing someone to have that. I think it's the big thing, like you touched on, is having that moment to say, this is what I'm
Right.
concerned about.
Yes.
Should I be concerned, or like
Yes.
I just need to be heard right now? And a lot of times, like even in this questioning, I remember someone saying more on the doctor front, it's like, if I and I one of the greatest, I thought this was useful more for everything. They said, the doctor asked, if I told you this is fine, would you come in again? Meaning, like, if I said, hey, nothing's wrong here, are you so concerned that you're like, no, there
Hmm.
is more of an issue? Or if I said, this is fine, where you're like, hey, I just need to double check, I'm not that concerned, I just had that inkling. And I think that's also the other idea of like how
Yep.
there's obviously, as a new parent or as a parent, there's always all these concerns, but like trying to figure out, is this a one-time thing? Like you said, figuring out, and
Yeah.
obviously as you develop, as children develop, there's stages.
Yes.
Again, like you're sick for a week, but it feels like such a long time. Figuring out where that is, and kind of, I guess, like you touched on, just being listened to mostly is the thing of figuring, okay, what are we doing here, but also how can we improve this so that
Yeah.
less stress, but also that we can progress if there are challenges to kind of get through
Hmm.
and create a better outcome. I'm assuming also a lot of people I speak to, and you touch on this a bit. There's always this interest, or I mean misconception. This is more of curiosity of like, what do you find is, and you touched on a little bit how it's working with youth is exhilarating. There's so much impact you can make so early on in their life, so that there doesn't become, whether it be more severe symptomology, or at least get themselves start out on the right foot. When people maybe ask, like, what would you say is the biggest difference in working with older, I mean, adults, or older teens versus the youth? Kind of what is that big difference? 'Cause I feel oftentimes, especially if you haven't worked in the field, in your head you have some ideas like, okay, they just maybe need more play based, but I feel if you haven't worked in the field, there's just always a vagueness of like, what is the difference? What would you say is the biggest, maybe not difference on the patient side, but on how you maybe work with them, especially as you get younger in age, that sticks out to them? Maybe not misconception, but maybe not known if you haven't worked
Yeah.
or had those hours in those sessions where you realize you have to kind of change your tact when you get to the younger ages.
Well, it's interesting because for years before I worked in the infant and early childhood consultation role, um, I really, with younger children, I oftentimes mostly kept parents in the room, right, and kept them engaged in this process. And again, I kind of was feeling a little bit like, am I doing the right thing out here? Because and the reason for that was, the child. I mean, they at that early stages may not be, again, there are exceptions to this rule, of course, right? But and the general family that's coming in, I want to see how they're engaging with each other, because really the parents at that young age, for in my mind, really help to support their calmness, their learning. How are they responding? Are they very anxious parents? And then if they're anxious outside this office, or in this office, they're really anxious outside the office too. And so how can I help, do that explaining of the behaviors, or teaching what something means, or guiding them in terms of like that playful response, right? And so and or settling certain things down a little bit, right? Of course, as I said, I would just want to say the caveat that that there is there were times that I would have to meet with a young child alone, but there's also that sense. And so when I then went into infant and early childhood mental health consultation, the concept there is you're helping to support the adult caregivers. in teaching them, supporting them in reflecting on what their experiences are with it, with that child or other children. How does that, how do they make meaning of the behaviors? And so so the focus, I interestingly enough, I was kind of going in that route, that pathway anyway. And when I got there, I said, huh, maybe I'm not so far off base. So versus like the teenager who you just want, they probably don't want that parent in there. And then there's some parents who will stay, even if you kind of want them out, and that tells you something right there. But also, they're clearly a lot more verbal, right? And
Yeah.
so there's a,
And I
to me,
think
there's a difference.
that's so
And I
interesting
love
because I
both
think
ends
you
of
just
that
touched on
spectrum.
is
So
a big part of whether it be the reason they're coming in. You can probably see the interaction because, like you said, and this is the classic thing. And this is, I mean, as a new parent, they always say,
yes,
if you're high stressed,
yes,
your kid's high stress because it's just a anxious environment. So it's that dynamic also plays a big thing. Where you're like, okay, this
yes,
is
yes.
less concerning. This is more of a, hey, overall, we
Yes.
can just address some of the anxiety in the room here. So I think that's super interesting. But I think what's always interesting also, as kind of we wrap up here, kind of getting to some of the final question is, you have the passion, you kind of love what you do, and it's very apparent. But I feel like a lot of people early on in their career, you have the same challenge where you're like, the world's my oyster. I have all these options. How do you choose what to do? I mean, this is a bigger question. This is like this is the classic at
Yes.
the end of a therapy session, you throw the most intense thing right when you have to walk out. But how, if someone's interested, like how do you help figure out where you want your career to go or kind of where to focus on? I know it's a very loaded question, but kind of in your experience, how have you seen being able to help make those decisions on maybe what feels right or kind of what focuses or delineations kind of really help find the career path, especially if you want to help people? There's a lot of people that help out there. How do you help people find their path?
I mean, I think one of the beauties of going to graduate school and being involved in early career options, doesn't matter where you're at, right, is you're trying different places, right? So you have to do internships. One of my internships was at a substance abuse treatment, outpatient substance abuse treatment program, an alcohol treatment program, right? So that was kind of obviously not what I'm doing now, but it's, another one was in a partial hospital program with adolescents. And so it was getting closer, and then just those early jobs, right? Like so I ended up going to a child guidance clinic and then kind of saying, yeah, I think this is kind of sort of my home, and so that for everybody. And I've done a little bit of home visiting for the elderly. I've done like I really, so you have those opportunities within your educational pathways, but then also those jobs that you take. I mean, I think one of my ideal jobs would be working as a summer camp counselor, back again, but I haven't been able to find one that kind of meets my criteria at this point. But yeah, there's different things that you try, and I think you have to experience them and be exposed, and then really talk to people in the field, right? Because there are people who I'm best friends with who completely are in the substance abuse realm, and they love it, and they're working with the adult heavily addicted population, and I think, wow, good. I'm so glad you are, so, and some of them are like,
It's
thank goodness
so
you
funny you
work
kind
with
of
the
touch on
kids
that
because
because
I don't want
I was
to,
talking to
so.
another clinician and they said in their career, they said like they're very myopic. They're like, I want to work in this field. Their whole life, they're like, I want to work in this field. They got an internship there and they're like, I hate this. It was not what I thought. And they're like, thank goodness I tried it out early because in my mind, I'm like, this is what I want to do this. And then you realize, and then they ended up with, they're like, I'll never
Yes,
work with kids. It's just too challenging. And then they had one of their internships, like, oh my goodness, this is
yes,
this is the experience. Also, deep
yes,
down, I do want to
yes,
go. I was a speaking of camp counselor, I
yes.
was a trampoline instructor at a summer camp, and I am always chasing that excitement of a fun summer camp job. So I think deep down, we're
Excellent.
all hoping to be summer camp counselors to some extent, somewhere in their career again.
There was a great
You
trampoline
can't
place
be
near us,
sat
and I
on a
used to do
trampoline,
it,
and
and it
that
was so
was
much
one of
fun.
my favorite
So,
careers for a good summer. But
no,
again, thank you so much. This was such an amazing chat, kind of hearing your passion as well, and kind of learning how to really navigate this world, especially on the youth side, where oftentimes that is just not really spoken about because it's so needed, but also a unique experience that kind of is a little bit different than maybe what most parents or people view as traditional therapy, even though it's very common, but most importantly, very useful, especially when it comes to that early childhood education and early childhood side of things.
Thank you.